Next on In Contact, heart disease and cancer are among the top major health concerns for men and the African American community. According to medical experts, the numbers are staggering. Coming up, we'll take a closer look at the issues and what men can do to play it safe.
Be informed, you gotta know what's going on in our community. So together we can make a change, you and me. Yeah, be in contact.
Welcome to In Contact Atlanta, Association of Black Journalists award-winning public affairs program that brings you community news you can use from around the Metro Atlanta area. I'm Paisley Moore, your host. We're coming to you from the AIB network in Midtown Atlanta, and we're so excited to be back after our show took a nearly 2-year hiatus due to the pandemic. Well, today we're covering men's health and the disparities among African American men. From heart disease, cancer, to depression, and more, experts say we need to continue to boost awareness about men's health in an effort to save lives. In fact, the Centers for Disease Control and Prevention reports men in the United States on average die 5 years earlier than women, and they die at higher rates from these leading causes: heart disease and cancer. Our discussion about men's health is essential to help raise much needed awareness about health care for men, and it also urges boys, men, and their families to practice healthy living decisions, such as exercising and eating healthy. In Contact's Tyreek Wynn is standing by here in the studio with more on Black men's health.
Thanks, Paisley. African American men sometimes face serious health challenges. In Contact went to Eagles Landing Family Practice in Stockbridge to talk to Dr. Marcus Allen about some of the most common health challenges that Black men face.
The issues that I see that's prevalent among my African American patients would be heart disease being number one, and then number two would be various forms of cancer. So we have lung cancer, prostate cancer, and colon cancer being number three. And specifically, I would say among the cancers, colon cancer is the one that's more prevalent in African American patients.
According to Minority Health, per 100,000, there are 518.9 cancer cases among Black men. Dr. Marcus Allen from Eagles Landing Family Practice explains how cancer works inside the body.
Cancer in itself is a very simple but very complex thing. In its simple form, it's just a mutation of our cells that allow our cells to continuously grow. So our normal cells, they have a signal in there that tells them, hey, you need to stop growing, and then they eventually, die and serve their purpose. Cancer cells no longer have that signal, so they continue to grow and continue to multiply. And when that happens, they start to take the energy and nutrients from our regular cells, and that causes us to get sick and causes the organs to fail.
According to Your Health, nearly 44% of Black men have heart disease. Dr. Allen says heart disease is due to what people eat.
African Americans, we love our food, right? We love our soul foods, our butters, our grease. We like to drink a lot of, sugars and sweets and everything. So all those things combined attack our blood vessels and leads to a buildup in our blood vessels, and that leads to blockages in our heart. And when you get a blockage of blood flow to your heart, that leads to heart disease like heart attacks and strokes. So long story short, it's mainly diet that causes it. It's a little bit of genetics that plays a role, but mostly diet.
He says a good diet consists of eating your meats baked rather than fried or sauteed, and also having half of your plate consist of vegetables with no butter, no cheese, and no salt.
I know it sounds boring and bland, but that's going to, carry you on through the rest of your life. Then for carbs, again, good carbs are just going to be like your brown rice, sweet potatoes, but not like the candy yams, just a baked sweet potato, no butter, no sugar, no cinnamon, none of that. Quinoa is another whole grain that's very good as well. And then outside of that, you have to eat your fruit, good fruits to eat. Berries are going to be your best fruits. They have a lot of fiber, and fiber is good for keeping you regular and keep you going to the bathroom. And they're low in sugar. So the berries are their strawberries, blueberries, raspberries, and blackberries. And then other fruits that are good are bananas and oranges. So essentially, you should eat that, some form of that meal 3 to 5 times a day.
And for steaks, he said it's best to eat them
Medium, and you can maybe do medium well.
Not only should you eat right, But Dr. Allen also encourages men to get regularly scheduled physicals. Some men fear going to the doctor, but Dr. Allen says men should step out of their comfort zone.
Regular checkups definitely are important. That's just to see, make sure your weight is good, make sure that your diet is good, and make sure that your blood work is good. And then the purpose of checkups is to do screenings. And these screenings help us catch these cancers and heart disease and things, help us catch it earlier. If we could catch these things earlier, then the prognosis is much greater.
Now, men should go to the doctor for a physical at least once a year. And if you think something is wrong with your body or your body's giving you certain signals, go see a doctor and get it checked out. Back to you, Paisley.
Thank you, Tyreek. We took our cameras outside in the community and spoke to men about what healthy living means to them. Take a look.
What comes to my mind is men actually being concerned about their physical health and their mental health. So when I hear men's health, a couple of things come in mind. Going to the doctor, make sure that you're getting your annuals and your physicals done, your blood pressure checked regularly, and being active in the gym and eating right.
Well, I work out all the time. I like to do workout activities that are fun and that keep it interesting and new and fresh. So I do a lot of cycling. I'll go walk up a mountain every now and again, do a lot of walking and steps like that. And I also have a personal trainer that I work with a couple times throughout the month to make sure that I'm really giving myself a challenge.
Well, it's very important to actually try to change your diet, especially as you get up in age. I've been noticing that a lot lately. As a young, teenager, you can kind of eat whatever you want to eat and just go on about your business. But as you come into those 40s, it's a different story. You know what I'm saying? So, your body doesn't react the same way to certain foods. And I've noticed that. I'm a country boy. I love the ribs and all the other kind of stuff. But now I have to kind of, pace myself with certain stuff that I eat and, watch my diet and watch the salt intake and all that kind of stuff. So now, like I say, it's more of a challenge because you really still want to eat that stuff, but you got to balance it out. So working out every day, much as you possibly can, it will kind of help and, benefit you in that way.
It doesn't matter what you do, just get up and do something. Like I said, make it fun, make it interesting. You can go outside and shoot some hoops. You can go walk around the mountain if you got a park or something like that. All of that is exercise and it all adds up. And the most important thing you can do is be consistent. So even if you're not going as hard as some of your friends that you see, they're sweating and they're doing all this stuff in the gym and they're lifting these heavy weights, you can definitely make an impact and just get started by doing just a little something every day.
Meantime, it's important to start early with healthy living. A new study at Emory University shows childhood obesity is on the rise. Researchers say obesity in early adolescence can be linked to poor mental health and are often precursors to chronic diseases in adulthood, including diabetes and cardiovascular disease. The study published in Pediatrics found that despite numerous public health efforts to promote healthy behaviors and to improve living environments, the rates of new cases of obesity in elementary schools are higher and are occurring earlier in childhood than they were even a decade earlier. The researchers analyzed at what ages children are most likely to develop obesity and which children are at highest risk. They compared data on children entering kindergarten in 1998 and in 2010 and followed them through the 5th grade. Major findings from the study include approximately 40% of today's high school students and young adults had experienced obesity or could be categorized as overweight before leaving primary schools. Children born in 2005 experienced rates of obesity at higher levels and at younger ages than children 12 years earlier, despite public health campaigns and interventions aimed at preventing childhood obesity. Non-Black Hispanic kindergartens had 29% higher incidence of developing obesity by 5th grade compared to non-Black Hispanic kindergartners 12 years earlier. Risk of developing obesity in primary school among the most economically disadvantaged groups increased by 15%. Still to come on AABJ's In Contact, a one-on-one conversation with our special guest, Dr. Richard Wright of Med-South Associates in Riverdale, Georgia. Don't go away, we'll be right back. Welcome back to In Contact, Atlanta Association of Black Journalists award-winning public affairs program. I'm your host, Paisley Moore. Today we're talking about men's health and disparities among African American men. And joining us today is Dr. Richard Wright, owner of the private practice Med-South Associates in Riverdale, Georgia. Dr. Wright has practiced internal medicine and primary care for more than 20 years. And after graduating medical school, Dr. Wright trained in internal medicine at Grady Memorial Hospital. His practice manages all primary care health problems, including diabetes, hypertension, prostate health, erectile dysfunction, obesity, and much more. Thank you so much, Dr. Wright, for joining us today. Based on your experience, what are the top health concerns for Black men?
Most of the health concerns for Black men are just the usual things that we hear about: hypertension, diabetes, prostate health, erectile dysfunction, obesity. All of those are major health concerns for the Black male community.
Okay, and with those special concerns, would that also be the same for Latino men and Caucasian men as well? Is that about the same health concerns for that group as well?
It varies a little bit for Latino men. It's pretty much the same. For Caucasian men, it's a little bit different. But all in all, it's the same type of problems that we're seeing. But the issue is that Black males lead the list in all of those categories, and we definitely have to find a way to make a change with that.
Okay. And can you talk to us a little bit more about prostate health and that impact and how that impacts the Black community?
Prostate health is very important. The major thing with prostate health is getting out and getting those screenings earlier. We have to encourage our Black males to get out and get screened, get the PSA screening, which is a prostate-specific antigen. It's a blood test that we do to determine whether your prostate is growing larger or whether there's any signs of cancer. What we've noticed is that prostate cancer is higher in Black males, and there are a number of factors that are involved with that. It could be genetics, where they're more prone to having a family history of prostate cancer, socioeconomic status, where they don't have adequate access to care, and if they do have access to care, they don't have the resources to pay for it. We've also seen things with education. Our Black males need to be educated about the importance of prostate health, and to know that prostate cancer itself is one of those cancers that it can grow and grow and grow, and you won't see symptoms for a long time. The other thing is that prostate cancer is more aggressive in Black males than it is in other populations. And Black males are 1.6 times more likely to get prostate cancer and twice as likely to die from it versus other groups. So it's very important for us to echo and get out there and tell our males we need to be getting in to be screened for prostate cancer.
Getting screened and early detection is key. That is very good information. Thank you, Dr. Wright. We're going to a short break here, and when we come back, find out how and why managing stress and depression play an important factor in healthy living.
All right, let's try this.
COVID has been a really long fight, and it's been especially tough on kids.
It's been a rough transition for all of us.
Right now, as a father, I want to give the best tools to protect my kids.
So what can we do to get back to that sense of normalcy?
Many parents are asking if it is worth it to get their kids vaccinated against COVID.
The answer is absolutely yes.
My own sons, who are 6 and 8 years old, had their COVID vaccine.
It's an added layer of protection to keep kids from getting any type of severe illness or complications from a COVID infection.
A lot of parents are also wondering if the vaccines are safe. Yes, it's safe and effective for children.
Definitely safer than a COVID infection.
Children get a smaller dosage than adults do.
So if you have questions or concerns about the vaccine, that's okay.
We're here to help.
We have the tools we need to protect kids and help them stay healthy and all get through this together.
Hey world, I have a quick message. It's about safe driving. All right, let's go. Anytime you're driving, have the seatbelt buckled tight, both hands on the wheel and your phone out of sight. When not in your hand trying to text somebody back, because if you do, your car might get smacked. The moral of the story, just put your phone down. The people on the road will stay safe and sound. Put your phone down, put your phone down. People on the road will stay safe and sound. Yeah.
Welcome back to the show. We're back with Dr. Richard Wright with MedSouth Associates in Riverdale, Georgia. He's offering great health tips for men. Now, Dr. Wright, according to the CDC, men in the U.S. die 5 years earlier than women and at higher rates from these leading causes of death: heart disease and cancer. What do you believe contributes to that shorter life expectancy for men rather than women?
The things I think contribute to it, a shorter lifespan for men, is that men have more of a sedentary lifestyle. They're not getting out exercising as much as women. There's been a whole push with women lately where they're getting out and forming these fitness groups. And one thing I commend the former First Lady, Michelle Obama, where she created a program where there's a healthy living lifestyle and the healthy eating lifestyle. So more women have formed these groups, whether it's in their churches or their sororities, where they have these fitness groups. And we need to get our black men to catch up to that. Second thing is more men are less likely to get a health checkup or a health screening, so they don't catch these disorders or these diseases in a timely fashion. So that's contributing to the shorter lifestyle. Black males are more stressed. They're more stressed also. And stress is...
What do you think are the contributing factors for black males experiencing that stress that you just named?
Yes, just the stress of society, jobs, racial biases, all these things contribute to the shorter lifespan for black men. Homicides also contribute to the shorter lifespan. And as we know, stress is a very contributing factor. Most people don't think of stress as two forms. We think of it as two forms. There's one form called eustress, which is EUSTRESS, which is a pleasant form of stress where you may be getting a job promotion, you're anxious about a test result, you get your test results, and you come back and you pass. Versus distress, which is the negative form of stress, which this is the one that leads to heart disease or strokes or heart attacks. All of these things, and also stress can suppress your immune system and also affect your reproductive and your digestive system. It can cause headaches, it can cause chest pain, it can increase your risk of increase the aging process. That's one thing a lot of people need to be aware of. Stress leads to diabetes, it can lead to hypertension. So all of these factors are affecting men and shortening their lifespan.
Exactly. And as you said, a lot of us underestimate the impact of stress overall. So thank you for explaining that. Now, my next question, Dr. Wright, obesity also plagues Americans. What advice would you give to overweight men?
Number one, as I've been stating a lot, and in my own practice per se, I'm encouraging men and women to bring their husband in. We need to get them in to get the screening first. They need to come in for preventive health maintenance. That's number one. Once you come in to get a preventive health maintenance, we're going to check a figure that we call BMI, which is body mass index. Your body mass index is basically a comparison between your weight and your height, and we formulate a number. If that number is greater than 30, then you're classified as obese. Globally, there's about 1.5 billion people that are obese. The second thing, once you've been cleared by your doctor to start an exercise program. I would encourage our men to start an exercise program, but make sure you've been cleared by your primary care physician first. Second thing is quit smoking, decrease alcohol intake, eat a proper diet. At my office, we have a close contact with nutritionists where I send my patients out to nutritionists so they can formulate a proper diet, proper eating plan so that they'll know they'll be able to lose weight, decrease the incidence of obesity.
And Dr. Wright, one more thing. I wanted to go back to stress because, again, I can't emphasize enough how important stress plays as far as impacting our health. So my question for you is, you gave some tips about overweight men, but what's the tip you would give about managing stress? How important is it to manage stress?
For one, I would encourage them to identify that there's an issue there. Seek professional help. I think that we should concentrate more on getting professional help, counselors, psychologists, psychiatrists to help you manage stress. Okay. Also formulate these groups where you can have people that kind of like a roundtable discussion where they're going in with people with like concerns, like stressors, to kind of talk and support each other. But it's very important for us to decrease the amount of stress in our community. These are some of the things that are really affecting us.
Since the pandemic, experts have reported a spike in mental health issues, again, like anxiety, depression, and you were talking about how to manage that stress. Are there any resources at your practice that you can offer our audience?
Yes. In addition to everything that you stated, we have a very comprehensive weight loss program at my office. I mentioned also that we're in close contact with dietitians. We set up those programs. We also have formulated, we do things like cosmetic things, like we do Botox injections for like migraine headaches and things like that. We're also in affiliation with Emory University, Piedmont Hospital, as well as Southern Regional Medical Center. So anytime that anyone needs further care, we can also refer them out to those facilities.
Thanks again, Dr. Wright, for joining us and sharing that great information.
Thank you guys so much for having me. It was a wonderful time talking about these health issues that are very dear and near to my heart.
Thanks again. That sounds like great, helpful advice there. You heard that from Dr. Richard Wright joining us. Thank you for all those helpful tips. And again, he's with Med South Associates in Riverdale, Georgia. That's our show for now. We appreciate you for watching. And a special thanks to our partners, AIB Network here in Midtown Atlanta, for helping to make this podcast possible. Please stay connected to AABJ on Facebook and our YouTube channel at Atlanta Association of Black Journalists. We'll see you back here next month. I'm Paisley Moore.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
If you need to do something to feel okay to drive, you're not okay to drive. Don't drive buzzed.
Every day, thousands of kids start vaping. And I can't let this happen to my kid. Of course, it's awkward to talk to your kids about the dangers of vaping. Hey, bestie, how's sketches? Vaping. It's hard to get their attention. Ready? Go. Yes. Look at that. You even turn yours over. So if you want to talk to your kids about the dangers of vaping, you got to get it trending.
No, you're doing it wrong.
Let's go.
Can we talk?
Yeah, what's up?
Visit talkaboutvaping.org for tips on when and how to have the vape talk.
Being prepared is a part of who you are, but it's especially important in the case of a disaster. Be informed about possible emergencies in your area. Make a plan that covers where you'll go in an emergency. Build a kit with the things you need to survive. There's no one more capable of planning for your situation than you. Start your plan today. Go to ready.gov/myplan.
Feel the beat of nature at a park or forest near you. Find a forest and music inspired by nature at discovertheforest.org.